Most of the time, pregnancy is discussed in terms of 3 trimesters, and it's usually during the first trimester when the baby's at the greatest risk for harm from chemicals, ergonomics, bad nutrition, smoking, and other problems. This is the stage when the baby's body parts are forming and the baby's brain's developing and things like that. The late second and third trimester, this is an increased risk for the mother related to ergonomic problems because her body's changing in size, her stomach's getting bigger, her ligaments are stretching. She's got some increased flexibility in certain areas that are putting more strain on her back. And the baby's also putting lots more pressure on their lungs and on her bladder. That's part of the reason that women find themselves short of breath. So, this is just showing a 1-month-old baby still in the womb. During the first trimester, here's some of the things that's happening to the fetus. The fetus is starting to look like a person. The woman's developing more estrogen to help the baby in her growth and develop her own breasts. All the baby's essential organs and structures are formed. The baby is about 2.5 to 3 inches long and weighs 1 ounce. The heart starts beating at day 26. His reproductive or her reproductive organs are formed. The liver starts making bile and the kidneys start excreting urine into the bladder. The woman also produces progesterone, which helps to relax the muscles of the uterus. It also causes some of the unwanted effects such as indigestion, constipation, heartburn. You can see some of the various symptoms that she's experiencing. I don't know if you're starting to get any of these symptoms yourself.
Oh,
yeah. All the above?
I don't think Danielle is yet. Okay, here's one of the many slides I have showing a pregnant woman. This lady's at week 12. As you can notice, there's not too many changes yet to her body, not too many noticeable changes to the outside of her body. The fetus is about 2.5 inches or so at this point. Again, this is just showing the fetus at 3 months old, and now it pretty much looks like a person. So the woman could start understanding that she has a person inside of her. By the end of the second trimester, the pelvic muscles are relaxing, stretching to increase the pelvic size. Several joints, especially in the spine, become less stable and show signs of separation to accommodate the growing baby. This is when some of the back problems can start. And if you notice all the changes, the greater tension placed on the ligaments and muscles, separation of the stomach muscles, the rectus abdominis muscles, that puts more strain on the lady's back. She accommodates for that. Now the fetus is about 10 inches long and 2 pounds. The baby's really a baby at this point. It's covered with some hair over the whole body. The fetus sleeps, awakes, opens and closes its eyes. It's really a baby at this point. This is just talking about what I talked about earlier, that the stomach muscles stretch and expand and separate to allow the stomach to grow. And this is really important because this puts a lot of strain on the lady's lower back to accommodate for this. Also in the second trimester, there's some changes happening to the woman. She gets some skin darkening, she may get skin tags, she may get moles, her fingernails get soft and brittle. And this is the woman again at week 20. She starts to look pregnant. This is an important time nutrition-wise for the lady and her baby because it's a maximum growth time for the baby. When the baby starts putting on most of its weight. There's the baby at 8 months old. It definitely looks like a baby at this point. This one's a boy here.
See it.
You see it? You notice it's a boy. And the woman also notices some hip pain. The pelvic joints loosen up. The baby starts moving around a lot more. You feel the baby kicking and moving inside of her. The baby really starts increasing weight at this point. The mother may notice a lot more shortness of breath. Again, we can see a lot of the symptoms that the pregnant woman is experiencing, such as sciatica, which is pain down the back of the leg. Very common for a lot of women in pregnancy. She notices a lot more sleeping difficulties that are just going to get worse as she tries to find a comfortable position to lay. Anybody with sciatica can tell you, even if you're not pregnant, trying to find a position to stand or sit or lay down is almost impossible. And again, we have our pregnant woman. In a non-pregnant woman, the center of gravity is located just in front of the spine, level with the kidneys. In a pregnant woman, her body shifts that center of gravity forward, so you can all remember a woman that walks with that waddled gait. This is part of the reason why. The pregnant woman at this point is going to solely rely on the muscles of her back, so you can see that if she has to stand for a long period of time, her back's going to get really sore at some point. And again, I just put another slide about sciatica, because it's such a problem for people, even non-pregnant people, having to deal with it. But it's a good thing for everyone to understand that that's what a pregnant woman's going through, so you can get some empathy for the pregnant woman. Sometimes the boss may look at them and think that they're just the same as a fat or overweight worker with a beer belly, but there's a lot of differences between somebody with a beer belly and a baby, and some of the hormonal changes that I talked about, the ligament stretching and all that kind of stuff is not happening the same to a beer belly person as it is to a pregnant person. So this is a common posture that causes women to go off balance, so if they have to do a lot of heavy lifting, there's dangers of them falling, accidents can happen. So that's something to keep in mind for the pregnant woman.
All right, thanks, Ivan. Just gonna bring this up here and put these up here. So, EMS, has anybody heard about EMS before? I know it's kind of a technical term, it seems technical, but it's just electromagnetic fields. It's anything that, it's invisible lines of electricity that stem from working machinery. And most commonly we associate it with monitors, but it can also come from any sort of machinery, even in a factory or wherever you're working, maybe in the mail room, something like that. This is, the VLF is very low frequency and the ELF is extremely low frequency?
Yes.
Yes, thank you. So those two are not a concern. It says that they are a concern. It's meant to say that that is a falsity. That's something that people tend to think is true. People think that monitors are still quite a concern. That was the case back maybe 20 or 30 years ago, but now the studies have been inconclusive to say that there's actual concern with the relationship between ELF and either miscarriages or birth defects. But it is something that you want to be, because the research isn't conclusive that it is definitely not a health effect, you should be concerned about, or you should be aware of it and limit your use of the computer, and especially if you're that close to the computer for prolonged periods of time. Similarly, if you're working with equipment. As I said, most research does not correlate EMFs, but there are some, it's kind of inconclusive. There are some that state there could be a relationship. So again, just take regular breaks from your exposure. Loud noise or vibration, pardon me. Anybody know someone that's working in a factory that's pregnant right now? No? Or working outside, construction, anything like that? No? Okay. Generally speaking, when you're in a factory, there is a noise limit of 90 or 85 decibels. And that is a risk for anyone, but especially for a pregnant woman. Not only will it affect their hearing, but it can affect the growth and health of their baby. So you should definitely be limiting your exposure to under these limits. Also, when you're talking about vibration, it could be anywhere from hand-arm vibration using hand tools, or whole body vibration that comes from flooring, or even when you're driving a vehicle. The problem with vibration is that it has an effect of like loosening the joints. And as Ivan has already said, with the hormonal changes that happen in a woman's body, the ligaments, are relaxing to create space for the baby as it grows. What happens in the rest of your body is that the other ligaments are relaxing as well. Add on to that the vibration exposure effects, and you're going to get loosened ligaments. Now if you go to do something strenuous after your ligaments have been loosened, you really increase your risk of injury. Or if you're not even doing anything strenuous, but you're just exposed for a prolonged period of time, you can increase your joint laxity and your risk of injury as well. So as I was saying, vibration further loosens the ligaments that are already loose as a result of being pregnant, loosening. Heat and cold stress. Again, this mostly affects people that work outside, whether it be in the cold in the winter, or whether it be in maybe a refrigerator, or coming in and out of a fridge or a freezer, deep freeze. Similarly, heat, again, if you're outside or if you work in a warm factory environment, anything like that, women need to be aware of the fact that for heat, as I said, laundry, kitchens, field work, use of heavy protective equipment, women are already at an increased risk of changes because their heart rate has been elevated with their baby. Their breathing is a bit more shallow because the babies are increasing their capacity in their belly. So women are not able, they're short of breath and they're not as able to do this heavy work. They're exposed to heat stress as a result. With cold, there we go. As I said, in cold storage, outdoor workers, wet or windy environments, if you work down by the water, women are not as able to adapt to these changes because of the changes that they're already having to go through as being pregnant. So it's something to be aware of and take into consideration that the personal protective equipment may not be able to fit them as well as it used to. So if they had a jacket, a heavy jacket that was originally protecting them from the cold elements, now all of a sudden they're increasing their girth and the jacket won't zip up, they may need to get a new jacket, and similarly with other things, pants and whatnot, overalls. Shift work and long working hours. It's best to avoid, especially when you're working with pregnant women, work weeks that are longer than 40 hours a week. As well, night shifts. Women are not as able to sleep as well, as Ivan has already said, so they're suffering from fatigue already, and then trying to work night shift on top of that can be detrimental not only to the woman, again, but to the health of her baby. Overtime hours, i.e. longer than 8 hours a day, that could be women that are working, nurses that are working 12-hour shifts, or any sort of driver, courier driver, they often work longer than 8 hours a day. So it's things to think about when you're meeting with workers who work in this capacity. Again, not only affecting their health, but their overall health, as we know, affects the health of the baby. Shift work, pardon me. That's right, no, that's wrong. Preterm births, that's right, I thought. So shift work has been associated with preterm births and also sometimes miscarriages. So it is a serious health effect, and pregnant women should be aware of that. Minimize rotating shift work, whereby workers are going from day shifts to afternoon shifts to night shifts. Really, they should just be on the day shifts and be able to sleep right through the night as best they can. So be aware of the rotating shift workers and repetitive or entirely manual duties. A lot of times women, when they're pregnant, are given just light duties, and by that we mean, manual things. However, if they're rotating through duties that are always manual, they're not really getting a rest from using their hands. And they're already retaining more water, and they've been noticing an increased risk of carpal tunnel syndrome with pregnancy. Add to that all this repetitive manual stuff, and you've really increased your risk for the development of carpal tunnel. A lot of times, the effects of carpal tunnel subside when when the baby's born. However, that's not always the case, and you may have set the stage for continuing carpal tunnel throughout the next few months or years. Heights and reaches. Oh, did I skip it? Oh, that's the next one. Pardon me. Thanks, Ivan. There you go.
Okay, I'm going to go ahead with some more of the body changes that the woman's experiencing. Her digestion slows, her corneas get thicker, her heart starts pumping more blood, she may get blurred vision, nasal congestion, and her heart's beating faster. Backache that we've already talked about, she may have frequent urination problems, progesterone relaxes. So again, these are issues for a worker. You may need more washroom breaks, you may need more time to go to the washroom, things like that that the employer has to keep in mind for a pregnant woman. So more about her respiratory system, shortness of breath, may start to subside a little bit at this point. Her respiratory rate will increase. This is just a short chart of showing some of the weight gains. Most of the stuff I've read, typical weight gains between 30 and 35 pounds. You want to tell us how much you gained?
Except for me. My kids are more like 10 and a half pounds. So,
So how much weight have you gained?
This one, so far, 22 pounds.
22
And I'm
pounds.
third trimester. So. The last two, my last one was 60 pounds and the first one was 40 pounds. Total.
So these were old numbers, I thought, and I thought more typically nowadays women would gain more, but I think the stats were showing 30 to 35 pounds.
Yeah.
This shows you some of the distribution where some of the weight goes. The baby doesn't take up a lot of that weight, but
Mine do.
unless you're having
They
20-pound
deliver, I lose
babies.
30 pounds right off, so I'm doing pretty good.
It's one heck of a workout.
Yes, big time.
All right, back on hikes and reaches. Thanks. Okay, so we talked a bit about the body changes. We know that as the woman progresses in her pregnancy, her belly is getting bigger. We know that her abdominals have created room for the belly that's coming out. As an effect, they've compromised some of their integrity. They're no longer able to add to the core stability as much, so women are relying more on their back muscles, which is going to fatigue and stress the back muscles that much more. So women are especially susceptible to that. And also with the increased belly, Ivan's mentioned the center of mass changing. So, and it's constantly changing because your belly is constantly growing. So just when you think you know where your center is, if I was to stand up here and close my eyes and someone were to push me, I could easily recenter myself back because I know where my center of mass is, and it's not that difficult. For a woman that's pregnant, unfortunately, if you were to push them forward or back, they're not quite sure where their center of mass is, and they've got less stability. So they've got to have a really wide base of support, and then they're all set. But they're not as comfortable with their balance, and they don't have as good a balance because their center of mass is constantly changing. It's really important to be aware of that, not only with working at heights and being up on a couple of steps or a step ladder or something like that, or even a ladder, but even with just reaching for something. If you're reaching forward or you're reaching behind you, that throws your balance off as well. Similarly with any sort of visual stimulation, that can throw off a woman's balance as well. So I'll just go through that. So your center of gravity goes forward a bit, which is again putting increased stress on your back muscles to hold you upright. So you've got fatigue in the back muscles. The pregnant women are more prone to, again, unfortunately, fall. Slip or tip, be unsteady. They like to place manual tasks at a distance because if, say, you were doing manual labor, they put you on light duties and you were just putting things together. If you put it here, you can't really see that anymore, so you kind of put it out a bit, which just what that does to my shoulder is it brings me forward, so I'm working out here, increasing my fatigue in my shoulders, possibly wrist and elbow problems as well. So they'll naturally put things at a bit more of a distance. It's important then that you eliminate overhead work, either you or your employer, because you're at an increased risk for slipping and falling. And you minimize your reaches that are below your waist because it's a little bit more strenuous for, so you'll notice when you go to pick up one of these, it's a little bit more strenuous for a woman that has a big belly, plus her back muscles are already fatigued all day from maintaining that upright body posture. So adding this lift and then requiring her to come back to standing is that much more fatiguing. Unadjustable workstations. It's always adjustable when you have several people working at a workstation. It's always, did I say recommended or did I say adjustable? It's always recommended that you have adjustable workstations when a multitude of people are working at the same station, but it's especially true when a pregnant woman is working there. For most people, we're comfortable working at about navel height, and that's great for us because that's where it's comfortable, our arms are neutral. However, for a pregnant woman, navel height is all the way out here, so that's actually uncomfortable for her. So she likes to work a little bit lower. That's what studies have said, about 2 to 7 centimeters lower, which doesn't seem like that much of a distance, but that's what they're recommending. Sorry, 6 to 12 centimeters. Anything higher than hip height, women, so if they were required to work at a table like this, they'd be more likely to situate their knees and hips this way and then work this way with a twisted upper body posture. So you've got strain on your back, shoulders as well. So it's something to be aware of if you notice that the surface that the woman is working at, or if you even notice the woman is twisting, maybe just lowering the surface can allow her to work in a more neutral position.
I'm just wondering if they're working below waist height, though, doesn't that add increased strain on their back?
Below waist height just means about hip height. So rather than here, they'd work 6 to 12 centimeters below.
And that doesn't increase the back strength?
Not that the researchers said, they said that was ideal, between 6 to 12 centimeters. And this is for standing, mind you, so this is not sitting, right? They tend to modify their movement with this new girth and this new body that they're living in. Excuse me. They tend to modify their movements and will have a lot more awkward postures. Also, their joints are a bit more lax, and they're suffering the effects of increased water retention. So their increase of developing a soft tissue injury has really increased. It's important to provide footrests for both sitting and standing, pretty much for every circumstance for every worker, but especially for a pregnant worker, because as their belly gets bigger, they're going to you tend to notice a lordotic posture with their back. What happens when you provide a footrest is it kind of neutrals out the spine a little bit more. So 1 foot at a time while they're working, and get them to vary their posture. 2 feet, 1 foot up, 1 foot up. Similarly, when they're sitting, that just takes a bit of the stress off the low back. Finally, we'll talk about prolonged sitting, standing, and driving. I've already mentioned a little bit about the effects of vibration when you're driving. So I'll talk a little bit about the effects of sitting. Unfortunately, people think that sitting is taking a break, especially for you because you work on your feet all day. And for some people it is taking a bit of a break, but when sitting is prolonged, and it lasts sometimes the whole day, it's actually an awkward posture. It takes out these giant muscles that are supporting you and keeping you upright. It takes that right out, and all of a sudden you've got a flattened back, and all of this upper body weight is through your hips. So Ivan has spoken a bit about sciatica already, but with the increased tension in through the back muscles, you'll also get increased tension in through your glutes. And when you have tight gluteals, or rear end muscles, they can impinge the sciatic nerve, and that's usually what leads to sciatica in the first place. So stretching is one thing, that's great, but with a pregnant woman, they're standing like this all day or they're sitting all day, they're going to notice sciatica for most of their pregnancy or a lot of their pregnancy. Anyhow, the effects of sitting and standing, again, affect both the mother and the fetus. It's important, they recommended in most literature that you stand or sit no longer than 2 hours, especially if you're driving. And you rotate and break often from those. So, you know, if you're standing for 2 hours or an hour, take a break, sit down for an hour, and rotate through those tasks as best you can. Oh, we've got one more, pardon me. Physical work and lifting, again, will hopefully get you through and try some lifting yourself so you have sympathy for what some of the pregnant women are trying to do. But it's important to notice that 50% of women experience low back pain. 28% of women experience carpal tunnel syndrome that may or may not subside after the pregnancy. Because of the body or the hormonal changes, they may notice an increased risk of these two things. There's an increased heart rate, as Ivan's already mentioned, so that makes you more susceptible to fatigue. Back injuries often result from lifting, and I've already mentioned the stretched and weakened ligaments. The abdominals have been stretched, the back muscles are already fatigued. The lifting mechanics are not consistent. It's awfully difficult for you to get into proper lifting technique when you've got this belly out in front. People tell you to, put the load between your legs and lift, but the load can't always be lifted in that way because it's an awkward load itself, and now you're in awkward shape trying to lift that, and it can be impossible to reach proper lifting technique. And there's a higher intra-abdominal pressure as the gestational age increases, so that can increase the forces that are on your back itself and increase your risk of a back injury. All right, Ivan, did you want me to test it out for you?
Okay, Taylor's going to show you the proper lifting technique. You need some help with it?
No.
Everybody pay attention because you're all going to try this afterwards and don't want anybody hurting their back.
Oh boy, this is really a lot heavier. I'm so sorry. Yeah. Okay. As I said, it's almost impossible to achieve proper lifting technique with everything, but it's important to keep certain things in mind when you're lifting an object. Keeping it as close to your body as you can will minimize the horizontal distance between you and the object and the effect of that lever arm on your back. Your back won't have to work quite as hard. Using your legs rather than your back to lift if you can, because your leg muscles are a lot bigger than your back muscles. And then moving your feet first. So always rotating your feet before you rotate your torso. Those are kind of the properties of proper lifting technique that we try and emphasize as much as possible. But it's not always.
Remember, no matter how much weight you're lifting, also try not to twist when you're down there bending. It doesn't
Okay,
matter
so
how much it
I'll
is
take it
if
up
you're
from here.
twisting.
Oh my goodness. Okay, so I try and keep my body upright, which is funny when this thing is getting rid of your legs. Keep your back tall, use your legs as best you can. Keep the load close. It's always good to have handles on a load as well. Makes it a lot easier for lifting. So if you have to do a series of lifts, try and get boxes that have handles on them. So you've got handles on them, you keep it close, keep your back tall, try and keep it in neutral spine so you're not rounding out. And then you just lift. Lift first, give it to Ivan and go. And when you're putting things down, again, not to tip from the hip, but to bend, straddle the object if you can. Put it down like that. Take this thing off me.
Prepare for the rest of the presentation, I think.
I gotta give you a bit of a 21. Yeah, this isn't even. I have to just do this for one quick minute. There we go. Oh my.
So everybody's going to get a chance, hopefully, to try that at the end. Maternal health, some of the greatest risks during the third trimester. She has problems with dexterity. We talked about her back problems ad infinitum, and we talked about potential for carpal tunnel syndrome. This is a figure showing how much increased weight is placed on the back of a pregnant woman because she has to carry it away from her body. It was interesting when I found this in the book, and that's why I put it up there. I'm just going to read it. A woman lifting a 10-pound object close to her body has about 65 pounds of pressure on her lower back. The same worker, now pregnant, lifting the same weight, now has 150 pounds of pressure on her back. So it's quite a big difference. Some of the important questions that the pregnant worker may be asking: is it safe to work while pregnant? How can I make my work environment physically comfortable as possible? What steps can be made to reduce stress and fatigue? And can I count on the support of my employer and coworkers? She may also want to know what health insurance and maternity leave benefits the worker is entitled to, and what options are available at work to accommodate ergonomic hazards. I looked into it a few times because it's a question that we get every once in a while from a pregnant worker who has concerns and wants to go off early. It's a little bit better now that the government gives a year's leave, and possibly 2 if they ever pass that one. I may get pregnant for that one. I know in that year leave you can go off a little bit early with a doctor's letter. I think it's 17 weeks, but you have to double check. In everybody's packet I put the only reference I can find is in the Ontario Commissions, and there's a little printout on that. Maybe you guys can answer when they can go off. You guys know?
I'm sorry?
Do you know when they can go off legally with that year thing? Soon before they deliver?
2 weeks of unemployment wait, and then I think. No.
I think with a doctor's letter, you have there's a certain number of weeks you can go off before it's delivered too.
Yeah, it would be dependent on the employer too, and, I mean, it would probably be more personal choice, and then the health condition of the mom, depending on how well she's doing.
Also in your handouts, there's a pregnancy ergonomics fact sheet that's a little old right now. I'm in the process of updating it. I'm just getting some articles in. Thanks to my students getting some articles in. I'll have to read to update the fact sheet. The reason that the clinic first produced the fact sheet was there were some workers at a plastics plant who were having problems with chemical exposure from the plastic fumes and that. So the worker obligingly moved them away from that part of it, put them into the assembly part. But then the workers started to have concerns about standing there and assembling and on their feet all day, and they wanted to know what effect that was having on them and their baby. So they approached us, and that's when we did some research and put together the fact sheet. Most of the research was focused on the baby, on the outcomes for the baby, not on the mother's health. And the 4 areas that we looked at was gestational age, birth weight, preterm birth, and pregnancy loss. Mother health was studied a little bit, but not as in much detail as the outcome for the baby. You're going to tell me this.
Sure. Do you want to hear?
Taylor's going to talk about this slide, but I just wanted to see if there's activists out there who want to get interested in something that's a good issue they could sink their teeth into and start getting their politicians involved as far as getting ergonomics legislation for Ontario, would be one step towards helping the pregnant worker. But also, when the pregnant worker starts to have some kind of concerns, if they would look into some kind of a legal way that she could be off work for the last 2 months of her pregnancy, probably would help a lot with all those health problems, as back pain, carpal tunnel, all those other problems. And based on the fact sheet, some of the health problems for the baby, that over years, if they have low birth weight, they're born early, won't get into pregnancy loss and spontaneous abortion, things like that. But those first two, they add health problems to the whole system later on in life too. So if we get the politicians to act early on, maybe we can help some of those problems, alleviate some of those problems.
More and more women are working well into their pregnancies. So did you find that for your last two, you were able to work pretty much right
No,
up
I went
until-
into preterm with my first son.
Yeah.
I moved a package over 25 pounds or whatever it was and went into labor.
Mhm.
And then my daughter, I think I was a month, I went off a month early,
Mhm.
just high blood pressure, passing out on my walk and stuff like that, so. But so far so good with this one.
Yeah,
So.
knock on wood. So, but again, I mean, even that, you worked right up until the last month, and more women are actually doing that, whether it means that they need that dual income or whether they're just choosing to work up until their last few weeks. So we're noticing more and more pregnant women in the workplace, and it's important to accommodate them. As Ivan has said, we have no ergonomic legislation in Ontario. Some provinces do, and some provinces are working towards a better ergo regs, but Ontario yet does not have any ergo regulations. So we're working towards that, and right now we're just using guidelines as a result. But again, this is just a summary of all the things that we've already talked about. It kind of gives you actually what your numbers should be, a little more specific. Limit your physical work. Beats per minute is the BPM, heart rate below 140 beats per minute at the maximum. And again, you don't want to sustain that for an 8-hour day, but that should be as high as you ever get. Limit your exposures to heat or cold. Limit your heavy lifting. We've already heard about the effects of heavy lifting, anything over 25 pounds. And when you go to pick up this guy here, this is only 21 pounds. So you can feel how heavy that is. Heights and reaches, again, limit those because of the change in center of gravity, change in center of mass, and the effect it has in the woman's balance. Limit your exposures to loud noise. Limit the hand-arm vibration is halves and whole body vibration. Limit your exposure to those. Again, limiting shift work because of the reasons that we've already outlined, long working hours. Unadjustable workstations, women do not fit the norm any longer, so a workstation that's just adjusted for the average person will no longer fit the average pregnant woman. Prolonged sitting and driving, especially prolonged standing, circulatory effects, all of the back problems that we were talking about, and finally the EMF exposure. Just to be aware of it and limit your exposures to EMF, although you don't need to be overly concerned because most of the research is saying that monitor EMFs anyhow have not been associated with problems.